Hey there. Over the summer, our pals at KFF Health News published a story with the headline, Insurers and Customers Brace for Double Whammy to Obamacare Premiums. So basically, whammy number one, insurers are planning to raise premiums for 2026, like by a lot. And whammy number two, federal subsidies for Obamacare policies are scheduled to get a lot less generous. So together, these whammies mean millions of people will be looking at paying a lot more every month, like hundreds of dollars more. So folks are going to need as much advance warning as possible to figure out how to prepare for a hit like that. Meaning, this is our kind of story. And this one hits a little close to home because one of those folks is an Arm and a Leg's senior producer, Emily Pisacreta.
Yeah, it's a wild time. I've never had to do this before because I've always had health insurance through work. Actually, I've totally shaped my life around that because I have diabetes, and without health insurance, I can't afford what I need.
But that health insurance has never come from an arm and a leg. When Emily started working here as an intern, she was the first person besides me to work more than a few hours a week on this show. We didn't have an employee health plan because we didn't have employees. And we're still so tiny. I mean, apart from summer interns, there's still only ever been one other person working more than a few hours a week besides the two of us. I'm still the only full-time person, so we still don't have an employee health plan.
And until recently, that worked for me. I had another part-time job, and that job had health benefits. Except my contract with that job just ended. So, for the first time, like more than 20 million other people, I'm looking at open enrollment. And I gotta say, it's one hell of a year to do that.
You're a double whammy case study. And to get a broader perspective, the two of us talked with Julie Appleby. That's the KFF reporter who wrote that double whammy story. And since then, you've continued to do more homework.
It's been pretty intense.
For real. And I'm a bit of a case study here too, because suddenly I'm finding out what our country's system, where health insurance gets tied to jobs, looks like from the employer side. I mean, it's a whole new adventure. We don't know exactly what we're going to do. Honestly, I don't think anybody does. But we've learned a ton about what we're up against, along with millions of other people, and our options. And by tackling this right now, and in public, like 6 weeks before open enrollment starts, I'm hoping we can help a lot of other people start planning early with solid information. Let's go. This is An Arm and a Leg, a show about why healthcare costs so freaking much and what we can maybe do about it. I'm Dan Weissman. I'm a reporter. I like a challenge. So the job we've picked on this show is to take one of the most enraging, terrifying, depressing parts of American life and bring you a show that's entertaining, empowering, and useful. So we started by checking in with the person whose reporting first got us looking at this story.
And is it recording?
Great.
It's recording. It looks like it says 10, 11, 12. Okay.
Perfect.
And I have notes, and I'll try not to rattle the papers.
Perfect.
I mean, if we have a reporter on tape rattling papers, I feel like that's probably okay.
Okay. That's a plan,
All right,
man.
cool.
Yeah. Why don't we start out? Could you just tell us your name and what you do and where you work?
This is Julie Appleby. I'm senior correspondent at KFF Health News.
What sort of stuff do you cover?
I cover healthcare policy, but that's a broad term. So everything from costs to the Affordable Care Act to what's going on with Medicare, all kinds of different things involving healthcare programs and insurance.
So we were really excited to talk with you because we wanted to cover all the changes to the marketplace plans that you've been writing about. And it just so happens that I need to enroll in a marketplace plan.
Let's give you kind of the rundown. There's kind of like two things going on here. One of them is that just premiums are going up, as they do every year, although this year it's bigger than it's been since 2018. So the median increase nationwide, and this is according to some data research by KFF, is about 18%. So that's a big jump, right?
Yeah. In your reporting, you called it a double whammy. rates are going up, enhanced subsidies are probably going away.
Right. That's the second half of the double whammy.
Okay, breaking in here. Gonna do this a couple times for Obamacare vocabulary. Emily just mentioned an important term. Went by kind of fast. Enhanced subsidies. So, Obamacare has always included subsidies for most people. That's part of the affordable part of Affordable Care Act. But for lots of people, Obamacare policies were still pretty expensive. So, in 2021, like as part of a COVID recovery package, Congress added extra subsidies for Obamacare policies, enhanced subsidies.
Basically, they made the coverage more generous on both ends of the income spectrum. In fact, I think I was looking at some statistics this morning, and something like 80% of people who have coverage right now have a plan that's $10 a month or less.
So these are folks with lower incomes where, paying $60 or $80 a month, it's a big bite. With enhanced subsidies, that becomes $10 or even $0. But people with higher incomes also got help. Before the enhanced subsidies, people with incomes above a certain level didn't get any subsidy. People called it an income cliff. So for the last 4 years, these enhanced subsidies, they kind of erased that cliff. If your income was higher, you just paid a percentage of your income, and enhanced subsidies picked up the rest. But the enhanced subsidies, they weren't permanent. They're going to expire at the end of this year. Unless Congress extends them. Otherwise,
people who make more than the 4 times the federal poverty level will not qualify for any help with their premiums under the Affordable Care Act. There will be that cliff.
Right.
And it turns out Emily is basically standing on that cliff. She shows Julie the numbers.
We found this calculator from KFF that attempts to show the changes in premiums if the subsidies expire. And maybe I'll just share my screen and we can look at what I'm looking at. Okay, you guys see KFF?
Yep.
Maybe just reload and I can enter some Emily figures in here. So they ask you about where you live and your yearly household income.
And what's the amount that you've entered as income?
I have entered $63,000. And it says, without enhanced subsidies, you will likely lose financial help because my income is 418% of the federal poverty level.
Ugh. And, okay, a little more Obamacare vocabulary. First, federal poverty level. 4 times that level is where you fall off the income cliff. No subsidies, 400%. And the calculator, which we should say was out of date, so the numbers aren't precise, but they're giving us an idea. That calculator says Emily's at 418%. Okay, one more piece of vocabulary. Obamacare plans come in different levels, like Olympic medals. So bronze, silver, gold. Bronze plans are the cheapest. They cover the least. And with a subsidy, the calculator says a silver plan would be like $400 and some a month. But it says Emily wouldn't get a subsidy. So
it would be about $880 a month for a silver plan or $675 a month for a bronze plan. So for me, that is stressful to read.
That is, that's a lot of money, $880 a month. So you're in the situation where you don't get any subsidies because your income is over that amount. I played around with one of these calculators too when I wrote a story recently, but I also plugged in somebody, let's say, whose earnings are kind of at the lower end of the income scale, say just over 150% of the federal poverty level. Mm-hmm. So they're still going to pay more. It's going to go from paying sort of a national average of about $2 a month to $72 a month or $864 a year. And remember, this is somebody who's making $23,000 a year, so $864 is a lot of money.
Emily, can you put that calculator back up on the screen for us?
Sure can.
The scary calculator. What would happen if your income were just a little bit lower?
Right.
If you just shave $3,000 from your income, what does it look like?
So maybe like 60.
I bet you could even shave a little bit less. Why didn't you make it 62?
How about 61? What does 61 do for us?
Can I get a 61? All right.
How about $60,500? I feel like it's like an auction in reverse.
I know. This is like the auction from hell.
Yeah, we're lowering your income. So Let's keep going. $60,200. That is it. Holy crap. It's a giant cliff.
Yeah.
It's a $5,000 cliff. Breaking in one last time. $5,000 is how much money Emily might save in a year on Obamacare premiums if her income stays below that 400% line. Put another way, it's how much more she'd have to pay if she were to step out over that cliff. Julie, what does that look like to you, seeing that?
I think this illustrates a lot of things. I mean, people are going to have to keep in mind that cliff for next year if these tax credits aren't extended. This is a projection. This is what you think you're going to earn next year. So that's one thing to keep in mind, okay? And something could happen. Emily could, I don't know, maybe she wins the lottery or she goes to the casino and wins a bunch of money and that puts her over.
Or someone offers me, a freelance job that's really interesting. It doesn't pay that much, but just puts me over,
You have to say, I'm sorry, that freelance job is going to cost me more than $5,000 to accept.
Mm-hmm.
So, Emily, listening back to that conversation now, what are you feeling?
I mean, I was trying to stay calm, but internally I was freaking out, or as Gen Z likes to say, I was crashing out.
It was really emotional. Like, we both needed time to cool off just to put this story together.
Yeah, this situation is stressful. I don't know for sure how much money I'm even going to make next year. And it feels kind of weird to put all of this out here. I don't know how any of this sounds to other people, because maybe it sounds like 400% of the federal poverty level is a lot of money. And in some parts of the country, it definitely is. But I live in New York City, so my income doesn't go that far. And that $880 a month we were talking about, that's actually a big hit.
Yeah, and I mean, not to pile on, but the data behind that calculator, the one where we got that number, $880, that's last year's data. So it doesn't include the big premium increases that Julie was writing about. The actual amount you'll be paying every month is going to be bigger. And you looked up the deductible on that plan. It's more than $4,000.
Right, which I won't have lying around at the beginning of next year either. Yeah, so honestly, all of it makes me want to scream.
Yeah, and you're a case study for a lot of people. Julie read us a really sobering number where one consulting group estimated that with this double whammy, Obamacare enrollment could drop by like half or more. And in fact, one of the reasons insurers say they are raising prices this year is without the enhanced subsidies, they figure a lot of healthy people are just going to opt out.
I can see why people don't sign up. I mean, I don't have a choice. But in order to get a subsidy, I'd have to lower my income and to a very specific number, which is less than I live on now, and watch it to make sure I don't take in a penny more.
While still paying hundreds of dollars a month for Obamacare, even with a subsidy.
Yeah. And look, this is a thing a lot of people do all the time. Intentionally limit their income to qualify for assistance. To keep Medicaid, people skip out on jobs, careers, marriage. So my situation is not unique, and it's definitely not the worst.
But you're our in-house case study. You can't stand in for everybody. I mean, just to add one more wrinkle, if you didn't live in a super expensive city, your premiums would actually be lower. Like, I used that calculator to look up what you would pay for a silver plan in Chicago. Like, where I live, way cheaper. Like, unsubsidized, a lot less than a New York plan with a subsidy. Just saying.
That's wild. No shade on Chicago, but I don't think I'm ready to make a long-distance move for health insurance yet.
I'm just saying.
Okay. But while we've been looking ahead to 2026 insurance, I've actually had a more immediate decision to make.
Right.
Like I said before, I had insurance through my old employer, but that's ending. While we were doing this story, I had to figure out health insurance for the last 3 months of 2025.
You ended up getting some help from a real expert.
I sure did.
And I called up an arm and a legs insurance broker. Because, like we said, if Emily's a case study, so am I. We're so small. I'm the only one here who's needed health insurance from this tiny little enterprise. But now things are looking a little different. So what we've learned and what's next, that's just ahead. This episode of An Arm and a Leg is produced in partnership with KFF Health News. That's a nonprofit newsroom covering health issues in America. Their journalists, like Julie Appleby, do amazing work. We are honored to be their colleagues.
So Julie Appleby left me with a little advice. Connect with an ACA navigator.
Navigators. So these are folks who can guide you through the process of signing up for Obamacare. They're not brokers. They don't make commissions. They're paid by the government.
But they're not government employees. Local organizations work on government-funded contracts.
Which makes sense because Obamacare plans themselves, they're basically local. The menu of plans you pick from, they don't just vary from state to state. They can be different from one county to another.
And I wanted a little perspective on how the whole Navigator program works.
And it turns out we know someone at the organization that coordinates all the navigators in New York State.
My name is Elizabeth Benjamin. I'm Vice President for Health Initiatives at the Community Service Society of New York.
We've spoken with Elizabeth before, like a lot of times, about her work pushing hospitals in New York to quit suing people over medical debt. And yeah, it turns out her shop also runs the network of navigators throughout New York.
But when we talked, it turned out her connection to the Navigator program is a little different than I'd expected.
I don't, run it day to day, but
Yeah.
I myself do help people individually enroll because it's really important to understand what people are experiencing, what their concerns are. I have like a small group of people that I help every year. Lots of friends' children.
Oh, that's awesome. Okay, yeah, I bet you're like a great auntie to have.
People that turn 26 and the parents are like, I know, please, will you help me?
She was like, look, everybody needs help.
The bottom line is, it isn't for the faint of heart. It is hard to work through these websites. I mean, they are as user-friendly as possible, but there's little moguls that you have to kind of ski over, and it's easy to kind of miss a mogul and faceplant, and we don't want that to happen.
And when I told her about how my story fits into this episode, she was immediately like,
oh, well, I can help you.
Not for my whole 2026 dilemma. There's just no information about 2026 plans out there yet. But for my immediate question, what do I do about the rest of 2025? She was like, I'm pretty free tomorrow.
You can tape your enrollment.
Oh my gosh, that would be amazing.
I'd love to.
Seriously amazing. I mean, it sounded like good tape, which we always like. But also, we talked that day, you and me.
Mm-hmm.
You were really weighing some big decisions.
Yeah. I mean, one was, do I sign up for Obamacare for the rest of the year? Or do I stay on my old employer's plan? Because a law called COBRA means they have to allow me to buy in. But I'd have to pay the whole monthly premium, which was super high, like more than $1,000. So Obamacare was looking good. Those extra subsidies are still in place till the end of the year.
But there was a downside.
Yeah, starting a brand new plan would mean starting with a brand new deductible. Money I'd have to pay out of pocket before the new insurance kicked in for most things.
And those can be thousands of dollars.
Yeah. But then there was this amazing surprise. So in New York, where I live, a new state law means that all Obamacare plans include insulin with no copay, even if you haven't paid out and hit your deductible. That's a deal I've never gotten from any insurance ever. And this deal includes other diabetes supplies like my continuous glucose monitor, which can be hugely expensive. So my thinking was like, I'll just grab the cheapest Obamacare plan and I'll get all my diabetes supplies and I'll just try not to go to the doctor for the rest of the year.
Okay, so ready?
I'm ready.
All right.
The next morning, I showed up at Elizabeth Benjamin's apartment.
So Emily, here you are. You're on my dashboard. Oh, wait, here, I can make this easier for you. Let's do the big screen. Okay.
Elizabeth started walking me through the application. Name, date of birth, address. Pretty routine to start.
Your phone number. This address is correct.
And at this stage, I'm starting to wonder if I should have just done it all myself and left poor Elizabeth alone. But after a while, once we started actually looking at plans, I was like, oh, wow. Elizabeth was able to really zip through things, and it was a whole vibe.
Hold on one second. That's not important. I want to see if this is in-network costs.
And she spotted things I would have totally missed.
So this is kind of an interesting plan because you would be able to go to a doctor or a specialist before the deductible.
Wait, you could do a doctor visit before you spent that deductible? That's a thing?
Yeah, in that one plan, I guess. But even Elizabeth had to really dig to figure that out.
Like, see, it's sort of a little frustrating because you couldn't really tell that from this. This is why it's helpful to have a navigator to say, okay, well,
super helpful.
Yeah, why is there...
With Elizabeth's help,
And you're done.
I got a plan where, well, I can't see a doctor before the deductible, at least not in person, but I can do telehealth.
Oh.
So if, God forbid, I get some kind of weird infection, I could still get a prescription.
Right.
Oh, and my actual doctor, like my endocrinologist, she's covered.
Wow.
And the deductible is much, much lower than other plans I'd been looking at. So, I mean, it's still scary as hell, but like half as scary as hell.
And the only catch is you have to do all this over again in November or December, except then, unless Congress extends the extra subsidies, you're probably going to be looking at much higher monthly payments.
Right. Actually, let's come back to me in a minute because the good news in my case, at least I'll be able to get Elizabeth's help again, which she offered, which was really nice. But also because even if she's super busy, I'll be able to talk to another navigator because I live in New York.
Yeah, this is something we learned from Elizabeth. And it goes back to one of the reasons we wanted to talk to her in the first place. Because there's another big change with Obamacare this year, which is the federal government is cutting funding for navigators by like 90%. So we wanted to hear from Elizabeth, how's that going to affect her group's work?
And this was a surprise. She said it won't affect her work at all because New York navigators are funded by the state government. Turns out the same thing is true for about half of the states. But I talked with Elizabeth's counterpart in a state where that's not the case.
We are not going to be able to reach the number of people we did before. That's just reality. You can't do more with less. People will lose their coverage because of this.
That's Nicholas Riggs. He runs the North Carolina Navigator Consortium.
We cover all 100 counties. We're the only navigator entity in North Carolina.
He says a big piece of their work is actually outreach, finding people who may not know that they can get this kind of help.
Yeah, there's no list of the uninsured.
And they don't just help people pick Obamacare plans. They help people sign up for Medicaid. So a 90% budget cut hits all of that. He says they're looking for more volunteer navigators, but it won't be the same as having experienced staff.
What you're losing is institutional knowledge. Volunteer navigators are great, but sometimes it takes a few years to really get a handle on some more complex cases.
I mean, Emily, you experienced firsthand how big a deal it was to have like a real expert walking you through this process.
Yeah, Elizabeth spent almost an hour with me.
Yeah, and a lot of people won't have that kind of help. I mean, this is one more crummy thing we're trying to help people plan for. So you found a map that shows which states fund their own navigators and which don't. So we're going to post a link so people can see what the deal is in their state. And Emily, let's come back to you for a minute. I mean, you are lucky to have access to maybe the world's greatest navigator, but unless Congress extends those enhanced subsidies, that next conversation with her, it's going to be a lot tougher.
I mean, unless I get another job with health insurance first.
Yeah. So about that, while you were having your first conversation with Elizabeth, I was talking with an arm and a legs health insurance broker, Kurt Kaufman, because I was like, well, what can I do to make it possible for Emily to stick around? So I asked Kurt, like, could we set things up for Emily, like to buy into an arm and a legs plan? Like, I mean, at all? Because our insurance is from Blue Cross Blue Shield of Illinois. Like, could it cover Emily in New York? And he was like,
yeah, that's fine. 100%.
She could be insured on our Illinois-based plan, even though she's in New York. Is that right?
All day long.
All day long. Okay.
Oh, yeah.
So I was like, okay, good. How much would it cost? And he said, based on your age, because insurance gets more expensive as you get older, like $500-$600.
Hey, that's a lot less than what the scary calculator said I'd pay for a silver plan without those subsidies. That was showing like $900.
Yeah. And these are 2025 numbers, just like everything else we've been looking at. Everything in 2026 is going to be higher. But it does seem like an arm and a leg gets a better deal than you'd get with Obamacare. However, there's a but. You'd need to be full-time.
Aha.
Yeah. I mean, we've got you like 20 hours a week.
Yeah.
I was like, oh my God. I mean, I'd have to double that? But Kurt was like, actually, no. The way insurance looks at it, if you were working an average of 30 hours a week, then you could qualify.
She could be meeting that definition of quote unquote full-time employee.
Which, isn't in my budget for next year. And I'm still working to make sure some other parts of our scrappy little budget get funded. But it's not double. I'm starting to think about it. Like a stretch goal. I mean, I would love to have more of your time. I don't know.
I mean, I like the idea a lot, but there are a lot of unknowns, right?
Yeah. So here's where we've landed for now. You've got health insurance lined up for the rest of 2025. After that, there is so much we don't know. Am I going to find more money? Are you going to take another job? And will Congress extend the enhanced subsidies? Like when we first started working on this story over the summer, experts were like, that is not going to happen. But in the last few weeks, some Republicans have been proposing it. Like, we definitely do not know. And it is nothing we can count on. And it's all, honestly, a little scary.
Honestly, more than a little.
But we know more than we did. We've started really confronting these scary numbers and the unknowns. And you've taken a practice run at picking insurance.
That was actually kind of a big thing.
It was, right? And I've started thinking about stretch goals. We're more prepared. And, I mean, here was the point of doing this whole case study. I hope we've just helped a lot of other people get more prepared to start planning. So, we will keep you posted on how things go for us, and some updates are going to show up in our First Aid Kit newsletter. And if you're not getting First Aid Kit, go check it out.
Yeah, actually, while we were reporting this story, we published a guide there called Get Ready Emotionally and Financially for 2026 Health Insurance.
That one has links to resources we talked about here, and we'll have more in this week's First Aid Kit. So, what you want to do is go to armandalegshow.com/first aid kit. And you'll find the whole archive there, including some recent notes about, honestly, some extremely exciting and heartening projects that an Arm and a Leg listeners are doing right now. And you'll learn how you can pitch in. We'll be back with another podcast episode in a few weeks. Till then, take care of yourself.
This episode of An Arm and a Leg was produced by me, Emily Pizzacreta.
And me, Dan Weissman.
With help from Jamaris Perez and Lauren Gould.
And edited by Ellen Weiss. Adam Raymunda is our audio wizard. Claire Davenport is our engagement producer. Our music is by Dave Weiner and Blue Dot Sessions. Dee Bosco is our consulting director of operations. Big thanks to Lynn Johnson, who just wrapped up her run as our operations manager. Lynn, your work has done so much to make our work more sustainable. I cannot thank you enough. And Arm and a Leg is produced in partnership with KFF Health News. That's a national newsroom producing in-depth journalism about health issues in America and a core program at KFF, an independent source of health policy research, polling, and journalism. Zach Dyer is senior audio producer at KFF Health News. He's the editorial liaison to this show. And Arm and a Leg is distributed by KUOW, Seattle's NPR station. And thanks to the Institute for Nonprofit News for serving as our fiscal sponsor. They allow us to accept tax-exempt donations. You can learn more about INN at inn.org. And finally, thank you to everyone who supports this show financially. You can join in anytime at armandalegshow.com/support. Thanks a lot, and thanks for listening.